Yes.
I'm trying to kind of do a schematic here, and I'm thinking it's hormone replacement therapy at
Mm-hmm.
the top.
Mm-hmm.
And then beneath that, you have natural options like the bioidentical, and then over here you have the synthetics. Is that kind of the
And are
way
you?
to look at it?
So the question is, do we divide bioidenticals and synthetics?
Yeah, for example, would you treat someone with bioidentical and synthetics, and is one better than another, or?
So, and are you talking specifically about menopausal treatment?
Yeah.
In menopause.
I'm thinking a synthetic would be Synthroid. Right?
Oh, you're talking about thyroid, or you're talking about?
I guess now I'm mixing things.
Okay.
So hormone replacement therapy.
Okay, so for
you have two options basically:
Mm-hmm.
bioidentical or.
Okay, so let's talk about hormone replacement for menopause symptoms, for example. So bioidentical is really, the definition is just it's synthesized from yam, by the way. So as opposed to Premarin, which is pregnant mare urine. Okay, so not considered. So you can always compare it to Premarin, right? So you can actually get a synthetic bioidentical. So synthesized just means it's just made in a lab, So, but you can actually get, now they make estradiol in patches and gels, so that can be a prescription, and it's still considered bioidentical because it's similar to our natural hormone. Okay. The difference is using a compound is we're able to put in there what we want. And if we want to add estriol, then we can add estriol. If we want to add progesterone or testosterone, we can do that. So does that make sense to you? Okay.
So compounds can be more individualized
Yes.
to the person.
Compounds can be more
even though
individualized.
You get the bioidentical on the shelf, as it were.
Exactly. Right. Precisely.
So compounds are bioidenticals. They're not. Is that hormone replacement therapy?
Yes. Yes. So if we choose to do compounds, and by the way, you can compound not only estrogens, progesterones. You can compound testosterone. You can compound DHEA. You can compound pregnenolone. A compound pharmacy can do all of that. They just make it. It's like the old pharmacies, where they just, you had write a little recipe and they would mix it up and that would be your medication. So they can individualize it. They can put in there whatever we want. Okay. The most common compound that I do is the estriol, estradiol, testosterone, and progesterone.
Now, I've been told that, is this appropriate to do before you stop having your period, even if you're having menopausal symptoms? I've been told, you can't do the hormone replacement therapy until you stop having.
So the question, can you do hormone replacement before menopause? About 5 to 7 years before menopause, the definition, about age 1 year with no periods, the average is about 51. A woman usually starts to lose progesterone. That's the first thing that happens. So the periods might still be happening, but there's irritability, sleep disturbance, maybe hot flashes, maybe more premenstrual symptoms. This is all what's called estrogen dominance. So we don't have enough progesterone. So what I recommend for women that have those symptoms is progesterone. So we don't usually supplement with estrogen until menopause, but premenopausally we can supplement with progesterone. We usually do it around try to make it look like the cycle where you peak your progesterone later in the cycle. So the last 10 days before the period is when we use progesterone. And we can use an oral or we can use a compound cream for that. Okay. Yes?
You mentioned DHEA several times.
Yes.
What is that?
DHEA is, no, it's actually an over-the-counter supplement. It's dehydroepiandrosterone. It's a precursor to the androgens. So I don't know if you recall that big stereogenic pathway, we could probably pull it up. So DHEA, there we go. So, one more. So there we go. So DHEA is considered kind of an androgen. So it supports the androgens. Men and women. Now, in menopause and andropause, that DHEA tends to go down. So it's a good way to support those hormones, kind of push it into this area here. But you can also take it even by itself. It actually goes very well with thyroid. It ends up supporting the thyroid. It's produced in the adrenal gland. If your adrenals aren't functioning well, if your cortisol is way too high or way too low, thyroid replacement is not going to be that helpful. You know, it's just, you have to really balance out both. But anyway, DHEA levels can be checked, and we usually try to keep it at the upper level of what's the reference range in someone who has fatigue or any of the symptoms of low hormone deficiency. You can also supplement with pregnenolone. I don't do it as much, but it's another way to kind of support the hormones without actually giving hormones.
Is that, how similar is pregnenolone to the DHEA?
Well, it's a precursor to progesterone. It's supposed to do, it does similar, I mean, someone with a lot of fatigue, it tends to help with that, as does DHEA. So it's another alternative, and you can actually check levels of pregnenolone. So it's just another way to support the hormones. Yes?
Is there a standard test for hormones, and could you give us the price range of the testing?
So the best test that, the testing, the best test that I have found is through Genova. It's a specialty lab, and so it has to be done at a doctor's office that you get the kit ordered from a doctor's office that is a part of Genova, or not part of Genova, but actually deals with Genova. Genova is a lab that does a lot of functional medicine testing. Extensively, and you can go on their website and see what they do, but it's quite interesting what they do. So the Genova testing, what I've been doing is the one called Hormonal Health Panel, which is a blood test, but more detailed is the 24-hour urine. It's a pain in the butt to do, but it gives you a lot of good information because it really does tell you the metabolites. The most important thing is, from what I get out of it, is how you're actually metabolizing the estrogen. There's also, it does a testosterone metabolism test. They also do complete digestive stool analysis test if you have digestive problems. They do the adrenal stress index, the saliva test for cortisol. So
So the prices vary.
Oh, the prices. Genova has a deal with a lot of the insurance companies where they do what's called pay assured. So it's a particular price that you pay as a copay. It's usually something like $150 or something like that, you know, maybe for hormonal health. But if your insurance doesn't participate, then it can be quite costly. It can be, you know, $400, $600. So that's kind of the limitation. Unfortunately, the regular labs don't do these metabolites. I've tried to look through LabCorp and Quest, and I just can't get the same results, so they just don't do it.